in principle, we looked into subgroups that were of interest and which we defined by the IMDC risk categories. So we looked into favorable or intermediate poor risk categories in order to really detect whether we have the same signal as in the overall cohort, because it becomes more and more interesting to look into these subgroups of patients because it's part of our recommendations and guidelines and so on. And so we found a very consistent signal of efficacy within those cohorts of patients. And I think that's what we also stressed in the poster. And in order to better understand, really what is the meaning of tumor shrinkage, we also did a couple of more investigations looking into hard to treat patients. So those that had kidney lesions, so that is mainly primaries in the tumor, and they're more bulky, more hard to shrink. And so we looked into these kind of patients, and we have seen a very strong effect that was consistent with the overall cohort. And then on top of that, we looked for depth of tumor shrinkage, whether that is prognostic in patients. And what we found is that there is more tumor shrinkage associated with Len-Pem for the combination. And once you have a deep response, it's very good for prognosis. And something that it indicates is that there is more than just patients that having a CR, having a really prolonged effect on overall survival from this type of therapy. I think, when it comes to really discussing what is the best approach to patients, I think the data is really reassuring that we can use Len-Pem in all kinds of risk categories, so in good, intermediate, and favorable risk patients. And I think that is needed in order to help the physician to guide the choice of therapy in the clinic.